Let's take you to this conversation. A dire humanitarian situation is playing out in Cabo Delgado, the northern region of Mozambique. According to Doctors Without Borders, thousands of people who fled their homes due to the Al-Shabaab insurgency have returned to their homes, but there is a dire need for basic services such as water, health infrastructure and humanitarian support. Francesca Zuccaro, Deputy Head of Mission of MSF, joins us now for an update on the situation. Francesca, appreciate your time. Will you paint a picture for us of what these families have returned to in the Cabo Delgado region?
Good evening, and thanks for having us. After 6 years of conflict in Cabo Delgado, the situation is still very volatile. And in the past months, we have been seeing multiple attacks that created newly displaced people in some of the districts of Cabo Delgado. This is what happened just 1 month ago with over 500 families who had been forced to flee again due to new attacks. After they had returned in one of the villages north of the district of Macomia. And after this attack, they have returned to the same place where they have been living in displacement for the past 2 years. And they've come back without anything, basically, so in need of shelter, kitchen utensil, water, safe water, food, and of course need of health and services, but also mental health and psychosocial support. And in reality, what we are seeing is that the people going back in their villages or in their area of origin, but this doesn't mean that they are and they feel safe when they return. So this is what we are witnessing in the last weeks, and the figures speaks. Currently, over 600,000 people still remain displaced in Cabo Delgado, while over 500,000 went back to the place of origin. But how many of them they are able to stay in their place of origin? This is the challenge in the past months, because we have seen many of them returning and fleeing again. And this is also one of the main impacts. Conflict, insecurity, violence, multiple displacement have a very significant impact on health of the population, but also on mental health. So that many of the family in Cabo Delgado, they're still living in fear and in insecurity.
That's obviously
yes.
It's obviously a very fluid situation in Cabo Delgado, and as Medicine Sans Frontières, I know that a few months ago we reported, I think, on some of your staff who were impacted by these issues of insecurity. Now, just how safe are you, and in the general context of things being in Cabo Delgado?
Well, as I said, insecurity is there, and is one of the main challenges, and also one of the main obstacles for access to remote areas where the people are going back, but it's difficult to reach them due to insecurity, and they go back in places where there are no services, there are no healthcare facilities. Most of the health facilities were been destroyed during the conflict, and are still in this situation. Just an example, between the district of Macomia and Bosimboa de Praia, over 14 health facilities have been destroyed during the conflict, and at the moment only 5 are working, so we can imagine how the population are facing difficulties in accessing, especially in the most remote area. So safety, security is impacting and is having an impact on the life of the entire population, and of course also for the humanitarian that are there, that are here to provide assistance and make the life, trying to provide the basic services and basic needs, and this is what is really still very is imperative to maintain and to increase the humanitarian assistance in this period and in this moment, while the population is still in need of infrastructure, but also still food, shelter. Rainy season is starting. People are living with nothing, covering with plastic often, and access to food is very limited. People have left their fields and their way of surviving and providing for themselves since years, and they are not able to at the moment to provide for themselves.
So that was going to be my next question, that when we look at these individuals, how do they survive? Are these farmers? Is this the communities that they're going to? Are there jobs for them? I mean, let's talk about the women and children. We talk about children because I'd imagine that they are traveling many kilometers from their places of displacement, going back to what were their homes. What is the impact on children? Obviously, they're not going to school. The risk that many of these women are exposed to.
Yeah, the risk are definitely they are facing a life very disrupted and in the past years, and at the same time trying to survive. Humanitarian assistance has been providing for them, but we have to be very careful in saying that there is the possibility, the intention or the possibility to decrease this humanitarian assistance. It's still very much needed, and especially women and children, most vulnerable. We provide, as MSF, we provide basic primary health care for displaced people and also for residents, of course, for the entire population, with health posts, through health posts, community-based services, mobile clinic, and also supporting the resuming of activities in the health centers and local hospitals. These activities include, of course, primary and secondary health care with life-saving referrals to the nearest hospital, which is 3 hours. Often is 3 hours by car, by ambulance from, for example, one of the projects that we have in Macomia. Other places that are not even reachable so easily. And also we provide very specific services for women and children, especially for women, supporting sexual and reproductive health, but also trying to support the facility-based deliveries, so helping women to deliver safely in health facilities. At the same time, providing water and sanitation activities in the community to improve access to safe water and, of course, to sanitation services. And other aspect of the services that we provide is for people living with HIV that has been significantly affected by the conflict and the disruption of the healthcare services.
Francesca, let's talk about how much aid is required to deal with the situation in Cabo Delgado, and if at all there is donor fatigue. And I ask this question because we were reporting on Sudan moments ago and how multiple millions in Sudan need aid. We've been reporting on what's been happening in the Horn of Africa, where there is much conflict and need for aid. And this is without taking a look at what's required in the Russia-Ukraine war or the Israeli-Hamas conflict. So clearly there are a number of challenges across the globe that all need some form of support.
Yeah, the trend is, of course, that many organizations and many entities are seeing, reducing some of the financial resources, and so this is going definitely to affect some areas. And for this reason, it's very important to keep, the light on and to keep attention to some of the situation that even though are going on since long time, 6 years, they don't see at the moment end or process to end and to go out of this humanitarian crisis. So the need is still there.
Thank you, Kandi, for that conversation, speaking on what's happening in the Cabo Delgado region in Mozambique, where hundreds of thousands of displaced women and children, men included, have been making their way back to their homes under immense difficulty.